Hi, Jackie Van Riller, your beauty magician here. And today we're going to talk about things that can happen in the reproductive system with females, particularly things like polycystic ovarian syndrome, uterine cysts, menstrual cramps, hormonal imbalances, and things like that, and how you can treat them using facial reflexology. So somebody on Instagram had asked me about how she would treat polycystic ovarian syndrome. And so your ovaries are associated with the area around your eyes. So if we look at this map of this is the reproductive system on the face. The ovaries are around the eyes. Fallopian tubes are up here where the eyebrows are. And this is the uterus, and then this is more like the vagina, lower cervix area. This is also the area where we work more for hormonal imbalances as well. And the eyes can also be associated with the breast, so any breast tenderness or swelling or anything going on in the breast can be treated in that area. So, polycystic ovarian syndrome is often associated with a hormonal imbalance where you usually have more of the androgen hormones, and it produces enlarged ovaries and cysts, and it's associated with acne and excessive hair growth on the face. And then also, a lot of people also deal with metabolic disorders as well, or blood sugar regulation issues. So, what you're going to do is take your detector or your rake or anything in there, and what you're going to try and do is find points in and around the eyes that are tender, dense, or zingy. Like I'm feeling some points right here, so I'm just going to hold it and just kind of breathe with it while that tenderness goes away, and just keep raking out further here. And anytime I find a point that feels tender, dense, or zingy, I'm just going to hold that point or keep raking over it, or just using my detector in the area to find points that are feeling a little tender or zingy. So I'm finding points right up here. And so you're going to do this on a daily basis, and you'll probably feel that your symptoms start to fade or go away, or at least become reduced. A lot of times people have things going on with their reproductive system, especially their ovaries will have puffiness underneath their eyes, or even discolorations like some hyperpigmentation around in this area. That's pretty common to see. A lot of times the things that are going on in your body will show up in your face as well, which is really interesting. I'm feeling some little zinginess over here. I'm just going to kind of work this area. This area right up in here between the brows can be associated with your pituitary gland, or your control center of your body. I'm just going to work up in this area. A lot of times people who have bloating in their lower abdomen, like below their belly, will also have tender zingy spots in this area. A lot of times that's more associated with the reproductive system than the GI system. I'm finding a point here, I'm just going to hold it. Take a deep breath and wait for that tenderness to go away. I'm feeling a spot that just feels a little bit like I'm stuck in there, so I'm just going to hold on to that spot for a little bit. Move on. This feels really nice if you do this right before you go to bed. It really just helps to relax your nervous system, calms your body down. All right, so I would work this area as long as it felt comfortable, so maybe 10 minutes or so. And then if you have stuff going on more in your uterus, endometriosis, cramps, things like that, you can work your nose. Or you can always work your nose along with your eyes if you have anything going on in the reproductive system. You can just work the whole system. And I'm feeling some nice tender spots in here, so I'm just going to hang out in this area for a little bit. You can just hold them if that feels better. Facial reflexology is all about what feels good to you. It shouldn't ever hurt. It shouldn't ever feel uncomfortable. You're not breaking your skin or pushing really hard or anything like that. You're just really just looking for those spots that feel a little more stuck or zingy. And I'm feeling them right in this area here. This point that I'm on right now is actually a point that stimulates the diaphragm. So it's going to encourage me to take a deep breath there and work down the nose. And again, I can be doing this with any of the tools. I can be doing it with a roller. I can be doing it with the rake. I can be doing it with a brush. And in fact, if there is blackheads, or if you have blackheads on your nose, which indicates some sort of a stagnation in your reproductive system, I would actually use this roller and roll this area, and that helps those blackheads to dissipate. And usually you'll see that them start to go away pretty quickly. Larger pores as well, you can just roll those out. The yang is going to be stimulating to your skin, and then I'll just follow up on the other side with the yin roller. Anything going on with your thyroid, you can work in this area beside the bridge of your nose. And a lot of times if people have things going on with their thyroid or their throat, even this area will feel a little bit lumpy, almost like there's a little nodule in there. Mine doesn't feel that way. I'm just going to try the other side here. Also, a lot of blood sugar issues can show up on this bridge of the nose or in this area. People with diabetes, especially if it's uncontrolled, may have some kind of purplish, bluish marks in this area, or low blood sugar can show up as just like a paleness in this area. So then I'm going to move down to the upper lip. And this upper lip area can be is good for hormonal regulation, and this point right here is a libido point as well. Stimulating this area can also help to reduce vaginal dryness. It's going to help with hot flashes. I'm just really getting in there and feeling where I feel either, this area does often feel like little bumpy areas, and so I'm feeling like a little bump here, so I'm just going to work that even though it doesn't really feel tender or zingy. And this area right above the lip. And if you're pregnant, you want to avoid this upper lip area. So avoid everything beneath the nose here, especially this point right as the upper lip meets the nose. That is point 19, also known as the ejection site. So it's going to eject things from your body, and you don't want it to eject your baby. Now, if you are ready to deliver, you're 40 weeks pregnant, and labor isn't starting, then you can push that point, and if your baby is ready to come, usually it'll provoke labor to happen within the next 24 hours or so. Also will make your labor less intense and less painful. I know I'm not pregnant, so I'm going to go ahead and work my upper lip. If you think you might be at all, just avoid this area completely. So just working this whole area of the body, the upper lip, the nose, areas around the eyes is going to be really helpful for any reproductive issues that you're going through. Polycystic ovarian syndrome, uterine cysts, menstrual issues, irregularities, excessive bleeding, hot flashes, any of those things is going to help. And then you just want to end with stimulating point 0. Point 0 is when you put your finger in your ear. You come out onto the side of the face, and you can just press in that area. You can do some massages in there, or you can take your 2 middle fingers and just do some nice stroking down the side of the ear. And that point 0 just sets in that routine that you just did, and it helps to regulate the body. So if you've overstimulated a point, it'll help you to just bring the body back into balance, because sometimes when you overstimulate certain areas, it can lead to just feeling like a little lightheaded or giving you like a little bit of a headache, and this will just bring your body back into balance if that has happened. Thank you for watching. Be sure to comment with other things that you want to learn about how to treat with facial reflexology. I love sharing my knowledge. If you're in Denver, I would love to see you for a facial reflexology treatment or one of my facelifting treatments. If you're somewhere else, look for a qualified facial reflexologist near you. It's worth getting a treatment. They are fabulous and very, very relaxing. And then your therapist can show you other things that you can do to treat yourself at home. I appreciate you, and I will see you soon.